If you're watching this video and it's 2, 3, 4 a.m. and the reason you're doing so is that you're clearly not sleeping, but why are you not sleeping? Is it due to acid reflux, heart palpitations, shortness of breath, anxiety? These symptoms are potentially completely related. And why is it that they wake you up in the middle of the night? You might experience these during the day as well, but there's nothing worse than being in a decently deep sleep and then all of a sudden awakening because your heart is pounding or you can't get a deep breath or you're spitting up acid. It's a miserable experience, and if this is you, I don't need to tell you it's miserable, but I'm here to tell you why. So what happens when we lie down, obviously when you're horizontal, gravity, we don't no longer have the benefit of gravity helping to sort of tether things down. So during the day, your stomach, which might be causing acid reflux during the day, at least there's gravity, as I said, kind of pulling everything down, because the phenomena that occurs with hiatal hernia syndrome is what it's called, is that the stomach gets compressed by an outside force, which we'll go into in a moment, but we call it from intra-abdominal pressure. So the stomach is a bag, and it's supposed to be a bag of acid by design. But when pressure is put upon it, just like a balloon that you fill with water, but you don't tie off the neck of it, and that's pretty much what the stomach looks like, actually, a little more kidney bean shaped, but the same idea. It has a neck. So if that's compressed, just like the balloon, you compress it, what's going to happen to the water? It's going to shoot up the top. So that is the corollary, is acid shooting up your esophagus, and then you're choking on it, you've got the heartburn, etc. So it's that outside pressure, because remember the stomach is a bag, so there's pressure being put upon it, and then the acid comes up. So what else happens? As pressure's put upon it, it gets pulled up because it can't get pulled down because it's attached to your mouth via that tube called the esophagus. So it gets pulled up, and what it runs into right above your stomach is your diaphragm. So there's one on either side, but it's a dome-like organ, actually, muscle/organ, that is very fluid, because of course it's what brings air in and out of your lungs. But as that stomach pushes up against it, it will elevate on that side, and then what's right above your stomach, right above your diaphragm, is your heart, you see? So these three organs are kind of meeting each other inappropriately because the stomach is being compressed, but it's being exacerbated by the fact that you're lying down. So if this is something that happens to you, you might have figured out, like getting in a lazy boy or propping yourself up in bed, which is also miserable. It's very hard to sleep that way. But you've probably noticed that being a little upright alleviates things somewhat. But we don't want just alleviation, right? We want resolution. We want this thing fixed, and it can be fixed, and it's actually not hard to fix. It's been our specialty for over 20 years now. So it's really about getting to the root of digestive imbalance, quite frankly. That's how it all starts. And then there's a little bit about the diaphragm, which I'll go into in a moment. But I wanted, first of all, for you to understand why it can be worse at night. I do want to say, if you're somebody this has happened to for the first time and you're suffering a lot of chest pain and heart palpitations, you do want to go to the ER. You do want to get it checked out. Heart disease is still our #1 killer. The hiatal hernia syndrome that I'm talking about is for those individuals who have been to the ER and they've been to the cardiologist to be told your heart is fine. It's palpitating, which is not normal, but it's structurally fine. You do not have heart disease. And so we've ruled that out. Similarly with the shortness of breath, a pulmonologist has ruled out, no, you do not have lung disease. So we've ruled all these things out, but what have we ruled in? And that's where we have a problem with our medical system that's very siloed, as the expression goes, which is the cardiologist is only looking for heart disease and the pulmonologist is only looking for lung disease. and you don't have any of those. Now, if you have anxiety or panic attacks associated with this, you'll quickly see a psychologist, psychiatrist who's more than happy to put you on medication for that. And I am being a little cynical because there's nothing wrong with your head. This is not a disease of your head. This is a physical problem having to do with imbalance in gut function, digestive function, and also diaphragm, which again, I'll come back to in a moment. So it's not all stress. It's not in your head. It gives you stress, of course. Nobody's going to wake up in the middle of their night with their heart pounding and they can hardly breathe. And of course you're going to be anxious. Anybody would be anxious. Anybody fears for their life. That's normal. That's a normal reaction. That doesn't make it a psychological problem, right? So I want to be perfectly clear on that, because there are so many people on drugs to slow their heart, even though their heart's not diseased, drugs to open up their lungs, even though they don't have asthma, and they're on psychiatric medication, which has a lot of dangerous side effects, life-threatening side effects. To be put on these drugs when you don't have problems in any one of those three areas is really not okay. Now, I've done several videos on antacids and the danger associated with them. Now, I'm not saying you can't get some temporary relief from them. That's fine. But that's on the road to finding out what's really going on. Because remember, the stomach is a bag of acid. It's supposed to be. That's its job. So it's not being bad by being a bag of acid. What's bad is when it gets inappropriately compressed and then it has no choice but to bring the acid up. Now, if you tend to have symptoms more in your upper throat, where you get hoarse, maybe you have trouble swallowing, you have some regurgitation, but you don't have the classic acid reflux, I do want you to know that 50%, so half, 50% of acid reflux is silent, meaning it's not the classic kind. It's not that burning and you're spitting up acid, and which is pretty dramatic, the classic heartburn. You can have the symptoms more in the upper part of the esophagus, and that's the silent reflux. It's still happening. Acid is still refluxing up the esophagus. It's just not gushing. It's not like whoosh. It's creeping up. It's still not good for your esophagus. Bathing your esophagus in acid is not healthy. So if you have the other kind, realize you're in very good company, but it still has to be fixed. And that's what we do here. We get to the root cause of why you have these symptoms. And it's a natural program. There's no drugs, there's no surgery. It's getting to the why of how did all this begin? Now, I have talked about the diaphragm a couple of times. It's a very strong muscle organ. It brings air in and out of your lungs, but it can get spasmed due to certain things that could occur. Now, for some people with hiatal hernia syndrome, this might be you, might not be, they have sort of a line in the sand of when this all happened for them. They'll say, you know what, I got a really bad case of food poisoning. I was vomiting a lot. And since that point on, this type of thing has been happening, okay? So it's something very dramatic. Another thing is someone with bad reflux, like, oh, I had reflux, it was sort of under control, and it got out of control, and I was vomiting a lot. I was vomiting acid a lot. Another thing we hear about is having to do with coughing. So somebody gets a really bad flu, they get pneumonia, they get something where they've just had this intense cough. I mean, people can break ribs from coughing. So it's vomiting is very intense. So it's these things that then cause your diaphragm to spasm, and that spasm diaphragm, because it's not moving as freely as it should, it's a bit spasmed. You're still breathing, obviously, but it's not moving as freely, then can begin this hiatal hernia syndrome. Now, the issue with the diaphragm with a perfect gut is unlikely to create hiatal hernia syndrome, but sometimes it is the coming together of a couple of factors. So I did want to mention that in case that's you. So I want to let you know we're here to help. We have a program that's very workable. We have different types of programs for different types of individuals. We do offer consultations so we can get to know you. And I've done a few videos to explain why I'm not saying do this or do that, because it would be unfair to you, and it would be trite, and it would be, I think insulting is not the right word, disingenuous to say it like that, you know. Drink apple cider vinegar, sleep with your head elevated. That's not going to resolve it. We're all about resolution. That's why we're called root cause medical clinic. You know, that's our sole focus. Get to the root cause and resolve it. And we're very good at that. So I understand if you're having trouble sleeping and this is freaking you out, and maybe you've been to the ER several times and you already know what they're going to tell you, so you've stopped going. I hear that from patients a lot as well. But you don't need to keep suffering. So please reach out for a consultation. We'd be delighted to help, and I want to get you not only sleeping again, but enjoying life and feeling great, because you deserve that.